Hello everyone. Today we are going to discuss MCQs on personal protective equipment known as PPE. Question number 1. What is the correct order for donning or putting on PPE? We have four choices. A. Gloves, then gown, then mask, and then eye protection. Choice B. Gown, mask or respirator, eye protection, and gloves. C. Mask, gloves, eye protection, and then gown. D. Eye protection, gloves, gown, and then mask. We are going to wait for a few seconds for the correct answer. And the correct answer is B. The correct sequence for putting on the PPE is gown, then mask or respirator, eye protection, and gloves at the last. This sequence ensures each piece is applied without contaminating others. Question number 2. What is the correct order for doffing or removing PPE? A. Gloves, gown, eye protection, and then mask in the end. B. Mask, then gloves, then eye protection, and gown in the last. C. Gown first, then eye protection, then mask, and gloves in the last. And choice D. Eye protection first, then gloves, then mask, and gown in the last. And the answer is A. The correct order for removing PPE is, first of all, we have to remove gloves, then gown, then eye protection, and mask in the end. Gloves and gowns are often the most contaminated and are removed first. Question number 3. When are gloves required as a part of standard precautions? A. Only during surgery. B. When touching intact skin. C. When anticipating contact with blood, body fluids, or contaminated surfaces. And D. Only when handling medications. And the answer is C. When anticipating contact with blood, body fluids, or contaminated, gloves are required. Gloves protect both the healthcare workers and the patient when exposure is likely. Question number 4. What is the main purpose of wearing a surgical mask? A. To protect against tuberculosis. B. To protect against airborne transmission. C. To prevent transmission of respiratory droplets. And D. To replace the physical distancing. And the answer is C. The main purpose of wearing a surgical mask is to prevent transmission of respiratory droplets. Surgical masks are used for droplet precautions, not airborne diseases. Question number 5. In which situation should an N95 respirator be used? A. Caring for a patient when influenza. B. Cleaning a patient's room. C. Performing aerosol generating procedures on a patient with suspected TB. And D. Feeding a patient. And the answer is C. Performing aerosol generating procedures on a patient with suspected TB. N95 are used for airborne precautions, particularly when aerosols are produced. Question number 6. What PPE is always required when entering the room of a patient on contact precautions? A. Mask and gloves. B. Gloves and gown. C. Gloves and face shield. And D. Gown and N95 respirator. And the answer is B. Gloves and gown. Contact precautions require gloves and gown to prevent transmission through direct or indirect contact. Question number 7. Eye protection should be worn when dealing with a client on contact precautions. B. There is a risk of splashes or sprays of body fluids. C. Only during surgery. And D. It is required by the patient. And the answer is B. When there is a risk of splashes or sprays of body fluids, eye protection, goggles or face shield is a part of standard precautions when splash risk is present. Question number 8. What is the most important step to prevent contamination when removing gloves? A. Pull them off quickly. B. Wash hands after. C. Avoid touching the skin with the outside of the gloves. And D. Reuse if they look clean. And the answer is C. Avoid touching the skin with the outside of the gloves. Gloves may be contaminated, so careful removal is a key to avoid self-contamination. Question number 9. When should PPE be changed? At the end of your shift. B. When moving from a contaminated to a clean task on the same patient. C. Only if visibly soiled. And D. Once per patient per day. And the answer is B. When moving from a contaminated to a clean task on the same patient. This prevents cross-contamination between tasks. Question number 10. After removing PPE, what is the final critical step? A. Discard PPE in a regular trash. B. Take a break. C. Perform hand hygiene. And D. Document in the chart. And the answer is perform hand hygiene. Hands may have become contaminated during PPE removal. Hand hygiene is always the final step. And that's all for today. Thank you for joining me.